So I was in my car, I was all alone, and I allowed myself to be angry. So I started screaming, literally out loud in the car, screaming. And I just got all that anger up and out. And then I imagined blowing up the hospital like in a cartoon with a TNT plunger, which is, insane. But imagining it was really a great way to let that anger out in a safe and healthy way. And then I took a deep breath and I relaxed and I just let the anger go. And so then I started feeling sad and I allowed the sadness to be there, because sadness is caring. And if I'm sad for myself, it means I care about myself. So I allowed the sadness to kind of morph into compassion and just was able to breathe. And the back pain just completely melted away at that point.
Hey there, I'm Anna Holtzman, and this is From Chronic Pain to Passion. I'm a licensed psychotherapist and coach who helps passionate creatives like you learn how to heal from chronic pain and other symptoms so you can reclaim your energy and live the creative life of your dreams. In my past life, I was a disillusioned video editor working in reality TV and struggling with chronic migraine for over 10 years. But after I discovered the mind-body methods that I'll share with you on this podcast, I recovered from the chronic cycle and got back my creative spark. And I want that for you too. So let's get into it. Hello, dear listener. Welcome to today's episode in which I got to interview one of my all-time heroes in mind-body medicine. My guest, Dr. Howard Schubiner, is an internist and pediatrician who attained the rank of full professor at Wayne State University School of Medicine in 1999 and is now a clinical professor at the Michigan State University College of Human Medicine. He is a fellow in the American College of Physicians and the American Academy of Pediatrics. He has authored more than 100 publications in scientific journals and books, and he lectures regionally, nationally, and internationally. Dr. Schubiner is author of the books Unlearn Your Pain, Unlearn Your Anxiety and Depression, and the co-author with Dr. Allan Abbass of Hidden from View. He maintains a virtual mind-body medicine practice at cormendyhealth.com. During our conversation, Dr. Schubiner told a powerful personal story that I'd never heard before, despite listening to many of his talks. And you definitely don't want to miss it, because this story is a phenomenal demonstration of how mind-body healing work actually works in real life. So without further ado, here's our conversation. Howard, welcome. It's so wonderful to have you here. Thank you so much for taking the time to be here with me and speak with our audience today.
Great. Well, it's my pleasure. I appreciate it.
You have had a big influence on my life personally, my own personal pain recovery journey, and also my professional journey. I'm sure that's something you hear quite a lot. I think many folks listening will already be familiar with who you are and your work, but for those who are new to you and what you do, would you mind just briefly describing what it is that you do and who you help with your work?
Okay, sure. I'm an internal medicine doctor, physician. I've been practicing medicine for 40 some years. I got interested in mind-body medicine about 20 some years ago through reading a book by Dr. John Sarno. And I went to work with him for a bit and started my own practice. And I started talking to people with chronic pain and trying to learn how I could help them. And it turned out that most people with chronic pain didn't have a structural problem to account for their pain. It turned out their pain was due to learned neural circuits in their brain. And most doctors don't know that. And then we've been working for the last 20 years to develop good ways to help people reverse and eliminate their pain. And it turned out it wasn't just pain. It turned out many people had other uh, physical ailments that were caused by their brain in the absence of tissue damage that weren't pain, such as urinary frequency, diarrhea, tinnitus, anxiety, depression, insomnia, chronic fatigue, a whole host of things that we've learned over the years. So kind of expanded who I feel that I can help over that time period.
Thanks so much for sharing that with us. Many of the practitioners who work in this field, including myself, have gotten into it because of their own pain journey. From what I've heard from you, I don't think that that's the case, but could you share a little bit about what led you to focus on chronic pain?
Well, it was, as I said, I had someone suggested I read a book by Dr. Sarno. I read it. I got interested. I started doing it and learning more and more. So I didn't come out of my own specific pain journey. In retrospect, I learned that the neck pain that I'd had for 10 or 12 years in my 30s and 40s was a mind-body condition. I didn't realize it at the time. It kind of came and went. I recognized that the irritable bowel type symptoms that I had as a younger person were also mind-body related. And then since then, I've had several times episodes where I've had a variety of symptoms that turned out to be mind body also. So my feeling is that having a mind body condition means you're human.
Yes, that's what I was thinking as you were speaking.
Yeah, I mean, everybody
Yeah.
has a mind, everybody has a body. Everyone's brain controls what they experience. Everyone experiences stress and turmoil and emotional upset in their lives. And so to have somebody not have any mind body symptoms ever in their life would be rare, I think.
Yeah, I mean, that makes a ton of sense to me. It certainly matches up not only with what I see in my office working with clients, but just being a person in the world, observing myself and others. Um, a question that I like to ask all of the physicians and therapists who I speak with is, there's such a wide variety of different mind body tools and techniques that you talk about and that one can use, ranging from expressive writing to somatic tracking and on and on. And I like to ask folks if you have any particular favorites, either that you use for yourself when you experience symptoms or that you've seen to be the ones you favor sharing with clients. And the reason I like to ask this is really to demonstrate that there's not a one size fits all, that one person might gravitate toward one direction while something else might work better for another person. So I'm curious about if you have any preferences.
Well, I don't, I mean, there are many, many techniques, and I've got a whole list of them that I use. But I think the model and the principles are the most important thing for me is helping people understand the model and the principles. And the model, the way I see it, is first of all, understanding how the brain works. So I spend a lot of time explaining to people and educating people, and I've written about predictive processing and how the brain actually creates what we see, what we hear, and what we feel in our body. And that's a mind-blowing, those are mind-blowing concepts that most people and most scientists and most doctors are really unaware of. So that's the first step. The second step is the assessment step in helping people understand, based on the criteria that we've developed and now published in a recent study, uh, the what I call the FIT criteria, functional, inconsistent, and triggered symptoms, so that they can know and investigate in their own lives uh, how the brain is working and how their symptoms are either more likely to be structural or more likely to be mind body based on what they are. And we can talk more about that later. But that's the second step. And then the third step I lump into what we're calling pain reprocessing therapy. And that includes uh, somatic tracking. That includes what I call provocative testing that we could talk about if you want. That includes, changing your relationship to the sensations, viewing them as not dangerous. It includes leaning into sensations. It includes what I call the bring it on technique or paradoxical intention. It includes, just during the day and the kind of self-talk that people can do. It includes outcome independence. And then the fourth step, really, I lump under emotional processing techniques. And that includes expressive writing. And it includes the other major therapy that we've done research on in randomized controlled trials, emotional awareness and expression therapy. And so that has a whole range of techniques that include memory reconsolidation and include dealing with emotion. I can talk to you more about that later as well. And I've used that most recently in my own life, if you want an example of that.
Yes.
So we can talk about that in a minute. And then the fifth thing has to do with how people treat themselves. And so, of course, and Dr. Sarno talked about this in his books a long time ago, the quote, personality traits, the folks who tend to have mind-body conditions and regular people, are they self-blaming? Do they have an internal critic? Are they putting everyone else first? Do they never stand up for themselves? Do they never say no? Do they feel guilty? Or do they take on more than they can do, et cetera, et cetera. And so a lot of those things have to do with how people treat themselves and how they take care of themselves. And that's a critical area that I think everyone needs to pay attention to. And then the final area is what you're doing in your life. And so this has to do with, and I know you focus on this a fair amount, this has to do with what is your life journey, what is your life passions, what is your life situation, and what traps are you in, or what situations are you in that make you feel trapped right now. Some people need to set boundaries with a family member. Some people need to change a job. Some people need to build a fence or move their house. So there's a variety of things in people's lives that are important to look at. So those are the 6 areas that I would conceptualize as how I see this work right now.
That's such a great overview for our listeners. And I'm sure there are lots of phrases in there that people will be Googling. I'll ask you about a few of them. But what's coming to my mind is just a question that I often get from clients or just people who reach out to me. They'll often ask me this: should I be doing the emotional expression stuff like journaling, or should I be doing the mindfulness stuff like meditation or somatic tracking? I'm curious if you get that sort of a question, that's kind of setting those up as opposite approaches and how you would respond to it.
Well, let me tell you the story of my story
Oh, great.
that illustrates these different techniques. So
Mm.
just over a year ago, uh, the hospital came to me and they said, we no longer need your services. I've been there for 20 years. I'm a physician. I'm highly esteemed. Everyone loves me there. Not that I'm that lovable, but
You are.
I'm respected. I'm respected. I've been there a long time, and I do good work. I've published a lot of papers. I've written books. I've seen a lot of people. But the hospital was going through a budget crisis, and
Wow.
they were losing money, and they needed to cut back. And I don't make money for the hospital. I'm employed by the hospital. I have a salary. I had a salary, but I spend time talking to patients, not operating on them, not injecting them. I take a long time. I'm talking to people, and therefore it's hard to make money doing that in our current insurance-based system. So they said, we're not going to renew your contract.
Wow.
And I said,
Sorry, I can't help expressing my own shock hearing that.
it was shocking. I felt like I got hit in the stomach that day. I was totally shocked. Came out of nowhere. I didn't expect it in any way, shape, or form. And they said it wasn't personal, but it is personal. And 3 days later, I started having back pain.
Mm.
And so it wasn't surprising to me. I knew I hadn't injured my back. So I knew how the brain works. I had that step down. I'd been teaching that for a long time. I
Mm.
knew that my back pain wasn't due to an injury because I hadn't injured it. And it would hurt sometimes when I was just lying in bed, or it would start burning when I was just lying in bed. And I knew that obviously if I'm not moving and you get this burning sensation in your back, that told me that the pain was coming from my brain, not from my body. Just that. And that's part of the fit criteria that we can talk about later if you want. So I had the second step down. So then I did the third step, which is the pain reprocessing therapy. So instead of resting, I kept moving, even though I was hobbling around, even though I had back pain. Instead of trying to avoid bending, I kept bending. But when I was bending or moving, I said to myself, I'm fine, I'm safe. There's nothing wrong with me. I'll be okay. And I said to my brain, go ahead, give me the pain. I can handle it. I'm not afraid of it. Right. So I did these, and I was trying to lean into the sensations and keep going. So that's the kind of the essence of the pain reprocessing therapy, you know, and allowing yourself to see the pain as a message from the brain rather than a damaged part in the body. And so I tried to have it calm down by doing that. What we're calling pain reprocessing therapy is what we used in the polar back pain study and randomized controlled trial. So it's very effective. Well, 2 weeks later, I was still having pain.
Yeah.
So my first step was that, but that wasn't, I mean, I certainly could do it longer, and not everybody gets better in 2 weeks. But anyway, it wasn't helping. And so 2 weeks later, I was riding in my car, and I realized that, you know what, I kept telling people the hospital let me go, and I would
Mm.
laugh like it was funny.
Yeah.
The hospital let me go. Isn't that funny? I'm like, I've been there a long time. They let me go. Isn't that funny? And then it just hit me, it's not funny.
Right.
It wasn't funny at all. In fact, I had a lot of feelings about it. And so that led me to say, oh, I need this fourth step. I need to do some emotional processing. And so this other technique that, again, we've done randomized controlled trials, our emotional awareness and expression therapy. And so I decided I needed that. So I was in my car, I was all alone, and I allowed myself to be angry.
Yeah.
I allowed the anger to come up. So I started screaming, literally out loud in the car, screaming. And I was swearing, and I probably shouldn't swear on your podcast.
You can if you
I
want.
was swearing again.
Yep.
Well, to be frank, I was just saying, fuck the hospital. Fuck. And I wasn't saying, I was screaming it.
Yeah.
Fuck the healthcare system. Fuck the insurance companies. Fuck the back pain doctors. Why aren't they firing them? Why are they firing me? And I just got all that anger up and out. And then I imagined blowing up the hospital like in a cartoon with a TNT plunger. And the hospital just blew up in smithereens, which is, insane.
Yeah.
Fortunately, I didn't do that because I would spend the rest of my life in jail. But imagining it was really a great way to let that anger out in a safe and healthy way. And then once I did that, all of a sudden I could let the anger go. I took a deep breath and I relaxed and I just let the anger go. And then it allowed other emotions to come in because I wasn't consumed by anger then, if that makes sense.
It does.
And so then I started feeling sad because it wasn't just anger that I was feeling, it was sadness. It was the hurt of being kicked aside.
Yeah.
And I just went to that hurt and the sadness. And it was interesting because it started reminding me of other hurts that I'd had in my life when I was young. My father hit me with a belt one time. And, some people had dumped me in romantic relationships, or I lost my starting position on the high school basketball team, things that in the greater scheme of things weren't huge, but they were other hurts. And I allowed the sadness to be there. And what happened then is that sadness, because sadness is caring. If you're sad for somebody, it means you care about them. And if I'm sad for myself, it means I care about myself. So I allowed the sadness to kind of morph into compassion,
Mm.
kindness for myself, which gets into how you treat yourself, as I was saying before. And I happened to get a phone call from a friend, another doctor, another mind body doctor, and he was telling me how sorry he was, and he was being really kind to me. And I just allowed that kindness to settle in and compassion, and just was able to breathe. And I got home. I had been in my car for an hour or so. I got home and the back pain just completely melted away at that point. And so that's an example of kind of using these models.
Yeah.
I didn't need to make a change in my life, but what I was able to do then is to forgive the hospital and have compassion for them as well, because they're just struggling and they're losing money. And they put up with me for 20 years and I never made any money the whole damn time. And so I was able to really let go and be kind, not only to myself, but be kind to them and compassionate to them as well. And so I could let go and I could walk away. And I found another position that was really better for me.
Mhm.
It turned out, fit me better at this point in my career. And turned out it was a blessing. It was something they did. It's not something they did to me in a sense, but something they did for me.
I'm so grateful that I get to hear this story and that our listeners get to hear this story. It's one story, but it's such a powerful demonstration of how this process can work. And something that came to my mind as you were speaking was I remembered when I was little and I took piano lessons, and the teacher would play something and let me place my little hands on top of her bigger hands. So I could just, because it takes time to learn something and practice something, and you fumble a lot and it gets frustrating and you want to give up. It's really helpful to get to just experience what it could be like
Yes.
running it all the way through.
Yeah.
And, and I encourage listeners who maybe are hearing this and have not had a round of this experience themselves yet, or don't feel like they have. I encourage listeners to maybe rewind and listen to you telling this story again and just notice, this is to the listener, notice how you're feeling in your own body. And just to give you maybe a hint, I'll describe how I felt in my body hearing your story. I noticed that when you first told me, because I mean, I know about your career, I know how established you are and how respected you are. And so when you told me that you'd been let go, I responded physically. I don't know if you saw this, but my eyes bugged out of my head and I braced myself and I probably giggled a little bit in the discomfort of not being able to grasp how to respond to
Mhm.
the situation. And then as you continued telling your story and you got to the part where you allowed yourself to express your anger, I felt, just this great exhale from my own body. It's not my experience, but I'm a human being too. So just hearing you describe it, I could feel the arc of these different parts of the process. And I encourage listeners to try that out for themselves.
Well, it was very, your listening was really beautiful to behold, because you weren't listening with your ears, you were listening with your whole body, your facial expressions and your caring. And I could really feel that caring and warmth coming through, and your support just in me telling that story. And I think when I told I blew up the hospital, you raised your arms in the air and an exultant glee.
Yes.
And that was just really nice. And I think that's often what's missing in, as I said, how we treat ourselves, but also, how we are with others. And a lot of people in their lives feel trapped or don't feel supported, and
Yeah.
or have been lonely. Loneliness has been increasing in the society at large. At the same time that back pain has been increasing, at the same time anxiety and depression has been increasing, et cetera, and all these other syndromes. Um, and so getting back to what it means to be human, the nature of being human is being social and being in relationship with others who care.
I appreciate hearing those words. And it also reminded me that something I was planning to say when we started off our conversation is, I mentioned that you and your work have had a big influence on me, but that it's not, I mean, a large part of it is the knowledge that you're sharing and the ideas, the concepts. Um, but I could read those in, several different books. A big part of it is also just the kindness you exude, specifically your tone of voice. And I hear a lot of people say this about you. They've heard you in videos or lectures or things, and your tone of voice has a big impact on people. Um, and it's something that I hear this theme a lot from the folks that I work with, that a lot of times folks with chronic pain have been to many, many doctors, and they're, as you're talking about, they're visiting doctors who are working in a stressed out medical system. The doctors have no time, they're not supported enough. And it's a systemic thing. And so the patients who are going to see these doctors, oftentimes, not always, but oftentimes they're getting someone who is brusque and out of time and, maybe irritated probably by other things that have nothing to do with the patient. And when they finally have an experience of a physician speaking to them with a kind tone of voice,
Mhm.
that's often the thing I hear from them as like a turnaround moment, rather than, something about it finally getting a correct diagnosis.
Yeah, yeah, totally. It's hard, and it's hard on young doctors. And I know several young doctors who have gotten pain themselves
Yeah.
from being in that medical system you're describing and feeling trapped in it and feeling frustrated with not being able to help patients and having too many patients and too many demands, et cetera, et cetera. And you know, one of the people who's is a young doctor named Dr. Hollander, Rachel Hollander, and her story is I developed a course on the Coursera platform recently. And Coursera platform, you can take this course for free.
Mm.
It's called Reign of Pain, and I feel like I can publicize it because it's free. I'm not selling anything.
Well, you're welcome to promote any of your work here, but yeah,
But I
go
was
ahead.
just thinking about that course because it really has there's a ton of information in it. It's free on the Coursera platform. And her story is highlighted. I did an interview with her. So
Yeah.
if people want to get a sense of that or hear from her, she has an amazing story as a physician, getting pain, being unable to work, pain being so severe that she couldn't work, and not knowing what was the cause, even though she's a physician, and going to other doctors and them not knowing what was the cause, even though they're specialists in these areas.
Yeah.
And her coming to read my website and read our books and just reading that material, it became so clear to her within 10 minutes what was the problem was, because it was so obvious. Once you understand these mind-body connections, it becomes obvious. It's easy to assess and diagnose most people.
Yeah. And I'll put a link to that in the show notes so that people can find it easily, the Reign of Pain on Coursera.
Mhm.
Um, you were mentioning something you're calling the fit criteria, and I'd love to hear you describe that. I'm not sure what it is, so I'm curious.
Yeah. So what we've learned is that as a physician, our job number one is to make sure, is there a medical structural problem or not?
Yeah.
And most people with chronic pain actually don't have a structural problem because they've already been to doctors. They've already had the testing to look for that, and they haven't found anything. Or what they find are minor abnormalities on an X-ray or MRI, which are seen in normal, healthy people. And so we just published, just in the process of publishing a study in the Journal of Pain, where we, meaning a good buddy of mine, Dr. Bill Lowry, in Lake Charles, Louisiana, evaluated 220 people with chronic neck and back pain. He's a physiatrist or physical medicine and rehab doctor. And their training is to diagnose structural problems. And so a physical medicine doctor, when they see people with chronic neck and back pain, they would look at the MRI and say, oh, the MRI shows degenerative disc or bulging disc or herniated disc. The MRI shows spinal stenosis. The MRI shows all these things. Therefore, that's the cause of your pain. But Dr. Lowry has been educated in our model, in our methods, and he now knows that just because those findings are there doesn't mean necessarily that's the cause of pain, because basically everybody has those findings on their MRI, even if they're 30 or 40 years old, and even if they're healthy and have no back pain at all. So what we did is we've developed criteria that I call the FIT criteria to help not only to help people what we call rule in a mind-body condition. And we do that by the example. And remember, I said, well, I was having this burning pain when I was just lying down. That's part of the FIT criteria. So the FIT criteria, F stands for functional. Functional pain or functional disorders are disorders where there's no medical issue found. You have diarrhea, but all the tests for diarrhea are normal. For example, you have headaches, but all the tests for head pain are normal. And it's functional in the sense that it's in a wide area. So it's like the whole left side of the body. Well, there's no disease that causes pain in there. Or it radiates down a whole arm or a whole leg, because nerve damage doesn't cause a whole arm or leg. Or the pain comes on in the middle of the night, or it comes on without any warning, or it came on without any injury, or it's in an area where there was an injury, but the injury healed. So those are some of the criteria under the functional category. The second category is I for inconsistent. And pain that's inconsistent means that it turns on and off. I got an email yesterday from a woman who said, I've got facial pain and I know it's due to the nervous damage. And I said, well, when does it occur? She said, well, it can go away for a few weeks and then it comes back. Or it can go away for a day and then it comes back. And it comes back at unpredictable times. Well, structural problems don't turn on and off. If your arm's broken, it doesn't stop hurting for a few days and then start hurting again. So this inconsistency, it varies with time of day. Sometimes in people, it's there in the morning, it goes away in the afternoon. It's inconsistent that it shifts. It might be in one part of the body, for a few hours, and then it shifts to a different part of the body. That's inconsistent. Structural problems don't do that. But neural circuits in the brain can cause pain to shift and move and turn on and turn off. And then the third category is T for triggered. And this means pain or other symptoms that are triggered by what I would call innocuous stimuli. So when your pain is triggered by stress, well, it's not a structural problem. The stress is causing the brain to turn on pain. When the pain is triggered by cold or heat or the weather or by wind or computer screens or foods that you're not allergic to or chemicals or smells or so many things that we can show that. And one of the ways we can show that is what I mentioned before, which is provocative testing. So if someone's having symptoms with a certain food, like a migraine or stomach pain or something, they can close their eyes and imagine eating that food, which is a silly thing to do. But when you imagine something, the brain is it's like you're actually doing it. And frequently people who do that will start to get some symptoms, anxiety or tension or the actual pain, just by imagining the food or imagining the weather or imagining a stressful situation or whatever. And that is an entree to help people see in their own life and demonstrate. And so what I'm calling rule in a mind-body condition. And then they know what it is. They say, well, I know I have these abnormalities on the MRI, but those could be normal. But because the pain shifts and moves and turns on and off and is triggered by the weather, now I know that it's not a structural problem. And that's the beauty of the FIT criteria. And so Dr. Lowry applied those criteria in this research study we did of the 220 some people with chronic neck and back pain. And when he was using those criteria, he was able to determine that 88% of the people had non-structural chronic neck and back pain. 88%. That is a
Mm.
huge number. This is a revolutionary study, we believe.
Yeah.
First time being published to show that, hey, we can confirm that 88% of people with chronic neck and back pain in this study didn't have a structural problem.
Is there a place, a book or a website where listeners can go to review the fit criteria?
Yeah, it's published in my book,
Yes.
and it's published in all of my books. It's published in this new study that's now available online. It's in the Journal of Pain, and
Yeah.
I'm the primary author.
Fantastic.
Yeah.
Um, I hear from a lot of folks who have heard this material. They've read a lot about mind body. They're familiar with this idea of the normal abnormality, like you were talking about. A bulging disc could show up on a scan, but that is not the cause of pain, you're saying, because other people have bulging discs and they don't have pain.
Right.
And yet I frequently hear people just stuck in this cycle of confusion. Well, I went to one doctor and that doctor insisted that the bulging disc is causing my pain. And I mean, authority plays such a huge part in what we believe to be true. So, when someone hears things from you, you hold a certain amount of authority, and that plays a part. They go to another doctor, that doctor's title holds authority, and that plays a part in the belief. And I don't know if you have any additional thoughts about how folks can help themselves get unstuck from this just quagmire of cycling doubt, if that makes sense.
There's a really famous line in one of the Marx Brothers movies called Duck Soup.
I
It's
love that movie.
1930 something, and it's a silly scene. The whole movie's silly, of course, but it's a silly scene where one of the Marx Brothers trades places with the other one, and the woman said, "But you left," and he says, "I think it's Harpo." He says, "Who are you going to believe? Me or your eyes?" And so it's a problem. What are you going to believe? You believe what someone says, or do you believe what you can see?
Yeah.
And that's why these fit criteria and this provocative testing are so important, because it demonstrates to people that they can see for their own self. The doctors are making assumptions. The doctors aren't using those criteria. They're not asking those questions. They're not asking, does it come and go? And if you say, yeah, it comes and goes, they're just saying, okay. They're not taking in that information and using it. They're just saying, but look what the MRI shows.
Yeah.
So it doesn't make any, when you look at the whole area of evidence and you put it together, you'll come to the right answer if you allow yourself to open your mind and let go of just because somebody said. Because doctors are only as good as what they were taught, and they weren't taught this material, so they don't know it. So if they don't know it, how can they incorporate it into their work? They can't, and therefore they're missing a big percentage. Because if you take, and every neurologist can tell you that 95% of people with chronic headaches do not have a structural problem. Every GI doctor can tell you that 90+% of people with chronic stomach pain do not have a GI problem. Pelvic pain, the same thing. And so we've shown that for back pain as well. And so, you just have to believe your eyes, believe your experience.
It sounds like, in part, you're asking people to have the courage to question authority and to look inward for some of that authority.
I'm a child of the 60s and 70s, and there were T-shirts, literally. I remember when I was in college, question authority. There were T-shirts saying that. And the whole medical profession, when I was in college, we had a pamphlet called Billions for Band-Aids, which now would be, of course, trillions for Band-Aids. But the medical profession has developed great things for helping some people with certain cancers, with certain, types of heart disease, etc. But
Yeah.
in terms of this area that we focus on, the medical profession hasn't. It's all band-aid type of treatment. It's symptomatic treatment. Why take this pill? Is it going to cure me? No, but it'll help with the symptoms. And so what we're looking at is the underlying actual cause of the symptoms. If you have chronic back pain, you have chronic headaches or stomach pain, you go to the doctor, they'll say, well, take this pill, or if that pill doesn't work, try this pill. If that pill doesn't work, try this pill. But they're all symptomatic approaches to treat the symptoms. They're not really looking at the underlying cause, because the doctor doesn't have the time or take the time or understand that asking about what's going on in your life might be the most important questions that they can ask.
I want to ask another question about this same subject matter, but just from a different angle. So one aspect of what I see frequently from clients and people I've worked with is they say, yeah, I do see myself in the criteria for mind body. I could see, how I'm a perfectionist and that's creating stress in my life, et cetera. But I'm just holding out. I'm not going to go all in on this mind body stuff yet because I'm holding out to see this next doctor that might say that I have this infection that needs to be treated medically, or that I might have this structural thing that needs to be treated surgically. And so another angle of a question I would ask is there any situation or condition where you would advise not using mind body techniques? Or can they be helpful regardless of the complexity of the condition?
Right, that's a great question. So certainly, as I said, the first job is to look for structural problems.
Yeah.
If someone has a structural problem, then yeah, we should just treat it medically. Of course, that only makes sense. You have a fracture, you have an infection, you have a cancer, a tumor, you have something that needs surgery. Of course. But most of the people we see have been through the medical system and been through the testing and have had, many times they've had a bunch of things. I saw a patient recently who was having severe back pain, and he went to the doctor, and the doctor said, oh, you've got a hip problem. Your hip is causing your pain, so let me operate on your hip. Well, that didn't make sense. He did get operated on his hip. It didn't help his back pain. Why would it? I mean, people, as you say, you do have to question, you do have to decide, because people have to take their own health in their own hands, because otherwise you can go down these roads. It's not only the medical roads that can lead to over assessing, over testing, over treatment, but it's also the alternative medicine model that can lead to over testing, over treatment as well. And these things can be very expensive. Sometimes they can be invasive and risky. And so if people would just consider, that one or the other might be there, then usually you can step back and with a little coaching and a little common sense can make good decisions. If somebody really feels like they want to go see one more specialist, one more this, I'm fine with me. It's their choice, and it's perfectly fine. If the person suggests an invasive and risky surgical procedure that's unnecessary, I certainly would advise them. But people have to come to this work on their own terms.
Yeah.
You can't force it on them, and you can't sell it to them. What we're there as guides and information, givers. There's probably a better word for that. So that people can make their own best decisions. Because as you pointed out, I think, and you know this, that people tend to do a lot better in this work when they do go all in, when they really understand that it is a mind-body condition and that they can recover. That's can be a huge release when they figure that out.
And I think it's so important what you said about you can't force this work. And it's not just because you can't figure out how to force it. It's because the whole point of the work is about not being forced by someone else. It's
Exactly.
about choosing, right?
Exactly.
Yeah.
Exactly. Yeah, and sometimes people will find out that it's a mind-body condition when uh, for example, somebody might be saying, I don't know, I'm not sure about this. I think I want to do some other things and try other things, and I'm fine. And it's like, well, do you feel, I might say, well, do you feel like I'm kind of forcing you or overselling you or pushing this on you? No, really. If you feel that, I would want to know. I think that's really important. And they might say, yeah, I do feel that. And I might say, well, what would you want to tell me about that? What would you want to say to me?
Yeah.
And maybe they say, well, back off, let me do it my way. And I'm going to, yeah, right on. Tell me
Yes.
more.
Yes.
Tell me more. Express yourself. Say what you mean, because for many people, as we talked about, they may have been very rarely able to express themselves in their lives. And so I could help them just to do that in a micro setting. And you know what? They might say, yeah, back off, Dr. Schubiner, leave me alone. I'm going to do it my way. I say, yeah, right on. You go ahead. Tell me more. Get it, be yourself. And then they'll do it. And then I'll say, well, how does that feel? Well, it feels good. Well, how's your neck feel right now? Oh, it's not hurting like when I came in. Like, oh,
Isn't that interesting?
isn't that interesting? Yeah. I mean, there's another one of the most amazing stories I ever heard was from a woman named Cynthia Austin,
Hmm.
which is she's also interviewed on that Coursera course.
Yeah.
And people can watch that interview. And it's an interview about a woman who grew up. I'm not going to tell you the whole story, but she grew up in a really difficult setting. She was in two difficult marriages. She could never express herself. She could never act on her own behalf. She could never speak up. And she ended up starting to realize she had a self. She had a purpose.
Yes.
She counted. She mattered. And she ended up um, leaving that marriage, leaving that town, going to live where her kids were. And as soon as she drove away from that town, her migraine headaches vanished. And she had a bunch of other symptoms that she eventually also got rid of. But she was basically barely able to move and walk in the throes of this very difficult family and emotional situation she was in, where she had no voice.
It's amazing. These stories are amazing, and this story really leads into the next question I wanted to ask, which is, this I named this podcast From Chronic Pain to Passion. And the reason I named it that is because I just have been seeing in working with clients and also working with myself through my own pain recovery these stories of people coming to me saying, I want to work on this symptom. I want to get rid of this symptom. That's the purpose of this work, is getting rid of the symptom. And then, however far into our work together, we're not talking about the symptom very much anymore. What we're talking about is that suddenly they're writing a book. Suddenly they're doing this like creative art that they never did before, but it's become their career. Or suddenly they are leaving the bad relationship, or they're getting back together with the spouse and starting a family together. Um, it becomes about something totally different from the getting rid of the symptom. I'm sure you obviously see this in your work, and I wonder how you would explain that. How does working on getting rid of symptoms lead to that kind of thing?
Well, it goes back to understanding how the brain works. So what happens is that our brain exists in a safe mode and a danger mode.
Yeah.
Our brain exists in a stressed out mode or a peaceful mode, or danger. Our brain exists in a fearful, worried mode, or it exists in happiness or joy. And when people are feeling trapped in their lives, and they're treating themselves poorly, and their life has closed in because of the isolation of chronic pain, not seeing people, doing less, being able to do less, etc. It's depressing, of course, and they get stuck in that brain state of fear and worry and depression. And so in order to get to this other brain state, they'll say, like, well, if I get rid of my symptoms, then I'll be happy.
Right.
But the path to getting rid of the symptoms is to figure out how to be happy, how to be purposeful, how to be creative, how to have meaning, how to have joy, how to have safety and connection, as we were talking about before, connecting to other people, etc. And so that's the not only the end, but that's the means of getting to the end. And so that's why those things are so important. If someone asks me what's the simplest way to overcome mind-body conditions, the simplest advice is know that you're not damaged, stop worrying about the symptoms, and do what gives you joy. Find meaning and joy and social connection in your life. That's the simplest way.
It's such a simple yet profound way to put it. And I can just hear in my mind the questions of some listeners. And so I'm wondering if there is a listener out there who's saying, yeah, I get it. That makes sense. I think I need to get rid of my symptoms in order to be happy, but probably if I could figure out what makes me happy, that would help with the symptoms. But it's just so hard to take that leap of faith and stop fixating on the symptoms, or it just feels impossible to focus on happiness and what makes me happy while I am suffering so much. I wonder if there is a word of encouragement that you might offer to that person.
Well, it doesn't necessarily have to be a leap of faith,
Yeah.
because if you do things that make you happier, you're going to be happier, whether you have pain or not, whether the pain is related to that. And as you asked earlier, can this help people with structural problems? Well, it can, because even if you have a structural pain, this pain is still filtered, it's still coming from the brain. And the brain can amplify structural pain or lower structural pain. And so doing this kind of work certainly can't hurt. My grandmother used to say it couldn't hurt.
Yeah.
And it certainly can't hurt. And it'll certainly make your life better, no matter if the pain gets better or not. And so it doesn't have to be all or nothing, but um, but it's amazing what can happen. And hope is a really powerful thing. And so many doctors have taken away hope from people by telling them they'll never get better, or they can't possibly recover from depression or from pain or from whatever. And and so that's why having these stories that people can possibly see themselves in other people, and see that other people have gotten better despite tremendous and severe symptoms. I was contacted the other day by a woman who's a singer, who's a really incredible, beautiful singer, who had to stop singing after she got hit by lightning,
Mm,
which is
wow.
pretty severe to get hit by lightning.
Yeah.
She survived, and she ended up having a couple of head injuries. She ended up having lots of pain, could barely walk. Now she's singing again. Now she's walking again, and it's really inspirational, to see what people can overcome.
It is truly inspiring. That's an amazing story. So much of what you say and do really does fly in the face of what many would consider conventional medical approach. And the final question I would like to ask you is if there is a soapbox message that you are most passionate about spreading through the work you do and the teaching you do, what would that soapbox message be?
Yeah, I mean, it's funny, as you were talking, you're saying it goes against conventional medicine, and I was thinking in my brain, yeah, that's why the hospital let me go. And I think the thing is not to settle, not to give up, not to settle, not to give up. And this goes for doctors as well as patients, because one of my favorite songs right now on my playlist is a song called "Settle."
Mm.
It's a really great song, and it's about not settling.
Oh.
And I'm thinking about the doctor I was talking about who was stuck in a practice and overwhelmed, and how can you think creatively? How can you try to figure out ways not to settle, and to see that there might be something better, to not lose hope, and to keep working and keep fighting, really, to get better, to recover. And so I think that's important. And
I
one of these
agree.
days it's going to be very, and these ideas, you can't hold them down forever. You can't keep a good idea down forever. And there's no doubt this stuff is so powerful, so effective, so easy, so simple, so common sense, that it's not going to be long before. I mean, it may not be in my lifetime, but it won't be long in geologic sense, for this work to be mainstream. And when you go to a doctor, they'll have a sense that, yeah, it could be a structural problem, but it could also be a mind-body problem too. And we have good and effective treatment for that.
Howard, thank you so, so much for your inspiring words in this conversation, in all of the teaching that you do, in the books that you write, the lectures that you've shared. You've personally inspired me so much in many areas of my life, including professional. I'm sure that you have inspired many folks who are listening to this conversation on the podcast. And for those folks who would like to connect with you beyond hearing this conversation, where can people find you, and what can they find you for? Are you working with patients? Are you teaching? What sorts of things can people find?
Yeah. I mean, I have a website, unlearnyourpain.com. There's training opportunities for people to do training and learn more about this, and a bunch of different course formats for professionals and for coaches as well. And people, our patients as well, can take some of these trainings. I do see patients or clients virtually, so I can see people from anywhere in the world through cormendyhealth.com. And so unfortunately we don't take insurance, so it's expensive, but I do see people, and I love doing that. And then I have, I lecture, do podcasts like this one, and lecture around the town and around the world, really. I'm doing some lectures in Europe coming up this spring. So, there's a lot going on. It's a really exciting time in mind-body medicine, and I'm not the only person. There's lots of other therapists and physicians and folks who are doing this work and teaching, and have courses for people, online courses, as well as in-person courses. So it's a really exciting time. We have the PPDA, the Psychophysiologic Disorders Association, which is a nonprofit group. It's our group where we have memberships, and members are professionals and also non-professionals. We have lower rates, and it's not that expensive. And we have a newsletter, and we're having a live in-person conference coming up this year in the fall, hopefully.
Oh, that's exciting. I didn't know about that.
Well,
Yeah.
we're just working on it, and maybe I shouldn't have said that yet, but
All right.
I'm committed to making it happen. I think it's going to happen.
Okay.
Like I say, we have a newsletter, we have question and answer sessions online, and a lot of resources on that website, ppdassociation.org. So
thank you so much. And I'll put all of those links in the show notes so people can find them easily.
great.
Howard, thank you so much for being here. It's just been a pleasure, an honor, and a delight. And I hope I get to speak with you again.
Thank you so much, Anna. Bye now.
Hey friends, it's Anna. Let me ask you something. If you're struggling with chronic symptoms, have you ever felt like pulling your hair out and screaming, "Why the bleep am I still in pain?" That's definitely what I was asking earlier on in my recovery, so I can totally empathize, and I would love to help you get some clarity. So I've created a quiz just for you that's called "Why the bleep am I still in pain?" And yes, you can take this quiz even if your symptoms are not pain specifically. Just head to my website, annaholtzman.com, and you'll see a big old button there that says Take the Quiz. So why don't you head there right now before you forget? And if you found this episode helpful, please go rate and review the podcast. That helps other people who are struggling with chronic symptoms too to find the podcast, and I would appreciate it enormously. Thank you for listening, and until next time, take good care.